time to talk a little sports medicine. Gentleman who's been informing us on that topic for over 25 years on the morning show, my good friend, Dr. Joe Congini from Sports Medicine Center at Akron Children's Hospital. Good morning, Dr. Joe.
Hey, Ray. We're still experiencing good weather. This has been a great fall, but it's finally starting to be a little bit nippy. We're going to be cold at some of those sideline games this weekend.
Yeah, that's for sure. You've got, Hoban and Overs and Barberton. We still got a lot of Division II, and, of course, Manchester and D5 is very much alive.
We have some really strong teams, and we always do. It is always this way. But in the greater Akron area, some of these teams are really strong. Wow, Highland, very strong. Avon, again, very, very strong. There's going to be Walsh, of course, a juggernaut. It's going to be a really, really interesting next couple of weeks.
What do you have for us today?
Well, here's the thing. I mean, I hate to go too common of a problem, but I go through these stretches, Ray, in my career, and I'm in one right now where, oh my gosh, everywhere I go, and that's a lot of what I do. I'm out in the community a lot. Is everybody wants to ask me about back pain, and I'm in one of those back pain modes where people are pulling me aside and saying, "Hey, doc, oh my gosh, back pain I'm having and struggling and issues related to back pain in sports." Back pain in sports is mainly what I'm going to be talking about, although, this time of year, back pain in raking leaves and back pain in yard work and that kind of stuff too. But back pain in sports, three major points I want to end with today. And I want to talk about in younger athletes, under 20. I've talked till the cows come home through the years about the very common injury known as stress fractures. And we have to manage that well in the pediatric sports medicine market and seeing kids. So stress fractures. But there's been an evolution in the last 20 years. I kind of had to check myself yesterday. So I walked down to somebody who's got about as much experience as I have, is Dr. Pat Riley Sr. If people around town know Pat, he's such a great orthopedist and a great guy. So many kids have seen him. To see if he's seen the same evolution. But in the last 20 years, there's more kids that have not just the stress fracture now, but disc problems as well. I didn't see that much early in my career, especially under 25, under 20, under 15. Almost never do we see disc problems. But you know how common disc problems are in adults. You know how many friends and stuff say, "Oh, my gosh, I got a disc, and what am I going to do with it?" And they're treated so differently. So that's why I want to talk about that today. And it's partly, as we say so often, kids so active, playing a lot of sports, doing a lot of big emphasis on weight training to get stronger. And there's a positive and negative to that. A lot of kids doing their weight training properly, under good guidance, others improperly. They just jump in a gym and start lifting weights and improperly and too much and issues like that. And we're seeing more than in the last 10 years, a lot more disc injuries. And I'm worried about the long run. So that's why I want to make a couple points today. With discs and with the way the back is made, Ray, there's 5 lumbar low back vertebrae, and between each of those vertebrae, there's these shock-absorbing discs. In the middle of the back, mid-back, there's 12 vertebrae. That's the rectangular bone that we see. And there's 7 in the neck, 7 cervical vertebrae. And so you can have a disc problem in any of those areas, but for so many of our athletes, they're struggling with low back pain. And so the big key is the treatment's so very different between adults greater than 30. And they get in and they begin to talk about, hey, might we get to a point where we'd have to do something with this disc surgically? Might we even have to do what's called a fusion surgery, where you actually remove the disc and fuse that area in the back? And that is not at all on the radar in young kids. And so the danger here is if people who have kids who have back pain who are 20 or 16 or 14 and they're having chronic back pain and they have now a disc maybe on an MRI, the first question they always ask is, okay, what surgeon do I see? How do we, get in to see surgery like, my adult friends do? If you're in a community that sees only adults, that's the story you're going to hear. And I really strongly recommend that you see sports medicine people, musculoskeletal people, orthopedic people that see kids, because it's very different in kids. We have so much better of a chance with appropriate non-operative treatment, of appropriate physical therapy, appropriate activity recommendations. Cutting back some, but maybe not to none at all. But what so many kids do is they just ignore it. They just continue to play through it. And our major goal is we don't want kids getting into their 20s and 30s and 40s and having back pain the rest of their life, or they have surgery at 20 and then another one at 28 and another one at 35 and have a bunch of surgeries in their life. And so that's what we really, really want to avoid. It's one of our major things in pediatric sports medicine is avoiding that chronic back pain. And so I strongly recommend that you take a different approach if you're a young athlete that's struggling with back pain, is get to somebody who's really seen a lot of pediatric or, younger people with back pain, younger athletes with back pain. And the resiliency and the study shows very high chance that you can get it healed, that these tissues will heal in a younger person. Maybe not so in our age range or even in 40s-year-olds that are really active and stuff, but it's treated very differently, and that's the point I really wanted to make today.
Yeah, back injuries, boy, sometimes you just say, I got a little pain, but right, Joe, with you working with backs for so many years, one, it could be a prelude of bad things to come. You certainly want to pay attention to back pain.
Definitely want to pay attention to it and put a good game plan together of not just for a day or two, but a 6-week, 8-week game plan to really treat this thing and make sure that we have you headed in the right direction over that period of time.
Well, Joe, speaking of sports and game plan, how about the plans of the Cavaliers to start this season, my friend?
Oh, my gosh, it's really something. I mean, enjoying it from the very first time I remember as a little kid. Oh, my gosh, we're going to have an NBA team in Cleveland down at the old Cleveland Arena. I may be one of the last people left, but I begged my dad to take me down to the Cleveland Arena to see the Cavs. I've never seen a start like this. This team is playing so beautiful basketball, aren't they, Ray, and playing together and everything? It's really fun to see.
They move the ball well, and they are deep. They're going 9-10 deep with that roster. And, again, they stay healthy, Joe. They're going to be a tough out in the NBA. Yeah. It's a long season, but they got a lot of talent.
Yeah, what is this with genius coaches that we have going on here? I mean, people are just absolutely – it's very, very early. You and I know that. Mm-hmm. But, oh, my gosh, everybody in the league is talking about our genius coach. So it'll be interesting to see how it plays out, but it sure is fun to watch right now.
No doubt about it, my friend. Thanks for the time, the visit. I know your mornings are busy. We'll do it again next week.
Thanks, Ray. Talk to you next week.
You got it. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Again,